are you doing today?
I'm good. How are you?
Good. Thank you for asking. Doing hand hygiene. Okay, can I get your name and date of birth?
My name is Victoria Santamaro, and my birthday is March 22nd, 2000.
Okay, let me just check that against your wristband. Victoria Santamaro, March 22nd, 2000. Very good. Okay, Victoria. So, if it's okay with you, my name is Amanda. I'm going to be your nurse today, and I'm going to be doing a full head-to-toe assessment on you. Okay?
Mm-hmm.
Okay. And I'm going to start with asking you some silly questions. And first, I'm going to give you three words, and I'm going to have you repeat them back to me at the end, okay? Okay, and those three words are cat, fish, dog, okay?
Cat, fish, dog.
Okay. And before I ask you any questions, are you in any pain right now?
No.
So on a scale of 0 to 10, it would be a 0?
Yes.
Okay. So, do you know where you are?
I'm in a hospital.
Do you know what today's date is?
Today's April 10th, 2020.
Very good. Okay. And do you know what season it is?
Spring.
Do you know who the president is?
Donald Trump.
Very good. Okay. So now I'm going to start by assessing your head, cranium for any irregularities, some even hair distribution. Okay. Now I'm going to look in the ears, make sure the ears, nothing in the ears. Okay. Now I'm going to get my light. I want you to look at my nose. Okay. Follow the light. Okay. Pupils are equal and round and reactive to light and accommodation. Now I want you to follow my pen. Very good. Okay. So now I'm going to be assessing your cranial nerves. I want you to move your eyebrows up. Feel the eyebrows. Okay. I want you to stick your tongue out at me. Make a big smile. Very good. Can you swallow? Now move your jaw up and down. Okay. Making sure there's no redness or any swelling in the lymph nodes. Okay, now I want you to push your head against my hand. Okay, and push it on this hand. Okay, do you know what sound this side is coming from?
Right ear.
This sound?
Left ear.
Okay, very good. I'm going to be checking the pulse, make sure the pulse is good. So that's the clavicle bone for any swelling. Okay. And now I'm going to move down to the chest. So I'm going to assess the chest, make sure that it's equal on both sides for any swelling, assess the breasts for any lumps or tenderness. I'm going to assess the arms, make sure the arms are same temperature on both sides going all the way down. I'm going to now listen to the breath sounds. Okay, I want you to take a deep breath for me, okay? Take a deep breath. Deep breath. Deep breath. And deep breath. And one more. Okay. So your breath sounds are equal on both sides bilaterally. Now I'm going to listen to her heart sounds, starting over on the right side, and then work my way to the left, checking for the aortic, the pulmonary, the tricuspid, and mitral at the end. Okay, and then I'm going to switch my bell, use my other side of my stethoscope, and listen to the same sounds, checking for any murmurs or extra beats. Okay. Very good. So heart sounds are good. There's no extra beats. Now I'm going to start at the abdomen. With the abdomen, first we inspect it, make sure that it is equal on both sides. There's nothing protruding. Have you had any pain in your abdomen? When was your last bowel movement?
This morning.
Okay, I'm going to listen to it. Your bowel sounds now. I'm starting in the right lower quadrant. Okay, listen at the bowel sounds. Move across the left side. Bowel sounds are good and normal. They're not hypo or hyperactive. Then after we listen, we're going to palpate the abdomen, making sure there's no tenderness or rigidity, looking at the size of all the abdominal organs, the liver, suprapubic area. That's all good. Now I'm going to move down to the GU. So when you void, do you have any burning, any frequency when you urinate, and when was your last menstrual period?
March 15th.
Okay, so you're not pregnant. Okay, and if this was a male, I'd be asking him if he had any kind of penile discharge. And do you have any vaginal discharge?
Mm-hmm.
Any vaginal bleeding that is regular from your period? Okay, very good. So now we're going to work down to the lower extremities. Okay, and we're going to assess the color first, going to inspect, make sure that things are symmetrical on both sides. These are both good. Now we're going to check for dorsiflexion, plantar flexion, so push against. And now I'm going to push against you. Very good. I'm going to check the pulse, this pulse, the dorsus pedal pulse, and then the pedal up here. Very good. So both pulses are present. Check the cap refill. She has good cap refill. Circulation is good in the lower extremities. I'm going to check for the Babinski reflex. Negative, it's very good. You feel that? Feel that? Okay. And so we've checked the lower extremities. Now we look at the arms, make sure that the elbows are good, there's no dry cracked skin. Check this arm, no dry cracked skin, they bend okay. These bend okay. Oh, and then we just have to bend your legs. Bend this. Okay, hip flexion is good. We can put the blanket back down. Okay. So after we've done that, now we're going to, can you tell me those 3 words?
Dog, fish, cat.
Very good. Okay. And before we finish up, I just want to get a quick set of vitals on you. So you said you weren't in any pain. I'm going to start with taking your temperature.
Oh, sorry.
That's okay. Just leave that in there. I'm going to check the oxygen saturation. You can put this on your finger. Checking the oxygen in the blood. I'm going to check her blood pressure. Make sure it's within range and not too high. Okay. And then take the blood pressure. Okay, very good. So blood pressure is perfect. It's 110/30. Temperature is good, 98.8 orally. Oxygen saturation is 100%. I'm just going to check your pulse. And then as I check your pulse, I'm going to watch your respirations. Time it for a minute. Okay, that would be a minute. So pulse is good, it's at 60. Respirations are good, they're at 12. So all of that is good, and you said you're not in any pain. So we write down all the vitals. Now I just want you to turn towards me so I can check the back breathing. Okay, so now I'm going to listen to her breath sounds in the back. Make sure they're equal and bilateral. Take a deep breath. Take a deep breath. Another deep breath. And one more. Okay. So breath sounds are good in the back as well. On the posterior, I'm going to also assess the skin on the back side, make sure there's no skin breakdown, no redness, no extra moisture. Her bony prominences are good. There's no skin breakdown or signs of skin breakdown. The legs are good on the back. Her heels are not breaking down either. They're nice and firm. You can lie back on your back, and then I'm just going to see your hands. Squeeze my hands. Okay, push against mine. Very good. I'm just going to check the cap refill. Her circulation is good in the hands as well. Okay, so do you have any questions for me?
No, thank you.
And is there anything I can get you before I leave?
I'm all set.
Okay, so do you have everything you need? Here's your call bell. Anything else that I can get you?
No, thank you.
Okay, so now I'm just going to deglove and hand sanitize and go and document everything that we just did. Okay?
Mhm.
Okay, thank you.
Thank you.
I'll be
Have
back
a
to
good
check
day.
in on you soon.